Every child with autism can look totally different, so just using the word autism doesn't really describe a particular child, neither does it help them get their needs met. So a diagnosis is only helpful insofar as it helps a child get their needs met. When you take the extra time to really understand the child and the family's situation, families really feel cared for and they're more willing to work with you. What they really want to know is what's going to happen to their child one day. They really need a path for their child to follow.
She told us it was going to be okay, that, you know, every child learns differently, and there was a lot of programs out there to help the children.
If a parent has a concern and you are not sure if the child has autism or might have autism, please ask for help.
I wish I would have known way earlier when they were his age and they were going like this with their hands, and I wish I would have known then.
Emotionally, it's very hard, particularly when you're young in your career, to actually use the word autism with parents, because frequently we see how devastating it can be. And yet, it's very important to start the conversation. And what you can say is, I'm beginning to wonder about the possibility of autism. It's so important to communicate, I care about your child. I want them to get the help they need. That's the most important message, that through your communication about the label or diagnosis, what you're really saying to them is, I care, I see that they are a very special little guy or girl, and that perhaps what we really need to do is better understand what they're struggling with so we can help them.
It is very helpful when you're talking with the family not to start with the autism word. I think when people hear autism first, they don't really hear anything after that. They kind of shut down. I usually do what's called a feedback sandwich. So I start by describing the child's strengths and all the things that the child can do. And then in the middle, I will describe the areas of development that the child is having trouble with. Lastly, I will talk about strengths that the child can draw on to help support the areas that they need some help with. Some families, when they hear diagnosis, may seem angry, and it's not that they're angry with you, it's just that they're angry with the situation and they're dealing with their own grief about it. Some families may actually feel relieved when they hear a diagnosis because they knew something was different about their child, but they didn't have a name for it, and now they know that they have a path that they can take.
When the doctor told me that it wasn't my fault, that made me feel better, because I did blame myself that maybe I did something wrong.
I don't think that a doctor should ever tell a family that their child will not be able to do something. Yes, it will be challenging, but you should never tell them their child will not be able to walk or talk, because it's not true.
I really think that sometimes doctors, just like firefighters, just like police officers, just get immune and maybe a little insensitive, but I'll never forget that doctor's name, the nurse's name, the doctor, what she looked like, what shoes she had on.
For us, it was a huge deal, but for her it was just saying, oh, another child's autistic.
Yeah.
Oh.
If I had to say something, it might just be, maybe be over compassionate.
Instead of using the word autism initially when I'm talking to families, what I will do is describe the behaviors first that I'm concerned with, things that they definitely have observed themselves. I'm going to ask you a leading question. Does he seem to be in his own world a lot?
Yes.
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 Emphatically. What are you and your wife thinking this might be? What are you all wondering about?
At first I thought it could have been autism, but I wasn't sure.
But you weren't sure.
The diagnosis helped us understand our child a lot better. Understanding that the world looked differently to them, helping them better access the world through their diagnosis and how they see the world, so that they can better access everything around them, bringing them closer to everyone and everything that they needed. This is still your child. This is still that baby you brought home and loved from day one.
When a child gets early intervention, they tend to do better. The sooner we can get therapy in place, the better it works. I would encourage families to not hide with this diagnosis. I would encourage them to go out and talk to other professionals, and I would especially encourage them to go out and talk to other families to get the support and information that they need. There is definitely hope for children with autism today. There's so many great programs and interventions that can really make a difference in the quality of lives that children are living.